Confusion over COVID-19 vaccines. Many are wondering if they'll be able to get vaccinated at all.
New federal guidelines only approve the vaccine for at-risk groups, meaning many Coloradans would have to get a prescription in order to get vaccinated. Governor Polis and state health officials are now stepping in, looking to make it easier for people who want to get a shot. Your reporter Sarah Horbakowitz is looking into this and joins us live from the state capitol tonight.
And Sarah, we know you're sorting through all of this for us. So can anyone, any age, get the COVID vaccine?
Karen, starting this Friday, anyone in Colorado, according to that new health report, can get the shot. Anyone who is 6 months and older. Now, I spoke with lots of doctors and pharmacists today who say this expanded access comes as a relief, but that there's still some gray area when following different state and federal policies.
These are troubling times and hard times. We have never witnessed this kind of confusion in the guidelines that are issued by the government.
Dr. Edwin Asturias has worked with vaccines for more than 30 years, finding himself and his work in the middle of opposing politics.
Even us, the healthcare providers, were confused about if we were able to access the vaccine or not when we know that we're caring for patients with COVID and with other infections.
The FDA's latest guidelines limits who can get a COVID vaccine and who needs to see a doctor first.
If you had to get a prescription, you had to get an appointment, which may be long and also expensive if you have to go and see a doctor.
But Wednesday, Governor Polis reacted with action.
So this was a total shock. When we heard out about that Friday, we said this is wrong because people should be able to choose to be able to get vaccinated if they want, not get vaccinated if they want.
The public health order allows patients in Colorado to get the vaccine without a prescription. But Emily Zvorny with the Colorado Pharmacists Society says she's still getting questions about legal liability and who's going to pay for it.
To have a conflict between basically government, politics, and real good patient care is something we're navigating the kind of the uncharted waters. Every company, every entity, every practice will have to decide on their own, given all the liability concerns, the conflict between federal and state, if they want to do that or not.
Because of the conflicting policies, pharmacies can still ask for that prescription, but Polis expects major shops to follow this expanded access.
But we checked with them, and they said if we did this order, they would be comfortable, like they do in other states, making the vaccine available here to people who want it.
The order does not require any vaccination, but allows those who want it to get protected without waiting or paying for a doctor's visit.
I think the bottom line is every patient should talk to who they trust. Their professional, whether it's their physician, whether it's their nurse practitioner.
The Board of Pharmacy has an emergency rulemaking meeting on Friday going over some of this new policy, and Governor Polis says everything should be good to go by the weekend. State health officials also say they're working with insurance to make sure the COVID-19 shot is covered. Meanwhile, shots might not be in stock at your local pharmacy just yet. Pharmacists are expecting them to come in the next few days or weeks. Reporting at the Capitol, Sarah Horbakowitz covering Colorado First.
A lot to iron out, Sarah. We appreciate you breaking that down for us. Thank you.